Good evening, everyone. So today's topic is allergic conjunctivitis. See, when we talk about allergic conjunctivitis, there's a redness of the eye. So there are many other diseases which can lead to redness of the eye, like conjunctivitis, corneal diseases, iridocyclitis, glaucoma, scleritis, subconjunctival hemorrhage. So these are the diseases which appear like there's a redness of the eye. But in case of So here you can see there is a redness of the eye. Maybe it is allergic, or it may be viral infection of the conjunctiva, or it may be a bacterial infection. But in case of allergic conjunctivitis, what are the symptoms? Main symptoms in case of allergic conjunctivitis is there's a lots of redness, there's lots of itching and watering of the eyes. And usually it's a bilateral condition where usually both eyes are involved. And there are types of allergic conjunctivitis. For example, one known as a seasonal allergic conjunctivitis, where usually it is according to the season. Like, for example, usually in April month, usually people have this allergic conjunctivitis. And this usually it is because of pollens or because of spores. So it's usually a temporary type of conjunctivitis. Whenever the season remains, there's a lots of itching. Next, you can think is perennial type of conjunctivitis. Perennial conjunctivitis, usually it is a chronic conjunctivitis, where whole year, usually the people will have symptoms of itching, redness, watering. And usually this is because of the dust, which are there, dust particles. And usually those who have animals like dogs or cats in the house, because of that also, people can have this type of allergic conjunctivitis. So here you can see the causes of allergic conjunctivitis, where the cause may be because of dust or pollens or spores, animal dander, or some medication also can lead to conjunctivitis. Some contact lens solution also can lead to allergic conjunctivitis. So here we have already spoken regarding the symptoms where there's itching, watering, redness, especially in allergic, and usually it is a bilateral condition. These are the two types of conjunctivitis. The third most common conjunctivitis, usually allergic conjunctivitis in children. This is known as a vernal keratoconjunctivitis, also known as a spring gutta. Usually in children, usually after 3 to 10 years, usually they have typical, lots of itching is there, and redness is there, and watering is there. And usually whole conjunctiva becomes, because of often or recurrent type of conjunctivitis can lead to little muddy type of conjunctivitis. And you can see it's not a bright sclera is not seen. And usually if you see them in the conjunctivitis, there is a clinical condition. Lots of papillae are there, papillae in the conjunctiva. Here you can see all that small nodules type of there in the palpebral conjunctiva. Nodules are there, and these nodules can rub on the cornea and can lead to corneal ulcer. Usually, in case of allopathy management, usually the steroid eye drops are given and decongestant antihistaminic eye drops are given. And if you give this for a longer time, also can lead to glaucoma, glaucomatous disease, which is difficult to treat. But if you start with homeopathy treatment, there's definitely lots of response with the homeopathy treatment. We have seen many cases of allergic conjunctivitis, especially in children.
All right. So I hope that you can hear me and see me okay. So I think Dr. Pushpa already discussed about allergic conjunctivitis, and homeopathy definitely has a very good scope in it. And homeopathy is generally very good for allergy, autoimmune diseases, and steroid resistant or antibiotic resistant kind of disorder, and especially in ophthalmic disorders. The idea in homeopathy is to go in depth. The case taking is in depth. We try to understand the person at as much level as we can in the case taking. And based on the case taking, we find a homeopathic remedy, which is chosen after studying the case in detail. And then we find a remedy that can really help to improve the immune system. So in such cases, especially the case taking is very important, and understanding the person is very important. In many chronic allergic cases of this sort, along with homeopathy, we also suggest certain changes in diet, certain changes in lifestyle. And with this together, remarkable changes we have seen with homeopathy and lifestyle change. So I highly recommend benefits of homeopathy and lifestyle change in people. We have our center here in Mumbai, in Mahim. You can either come in person or we can have an online consultation for any of you or your friends or colleagues who requires such kind of help in these cases. Thank you.